Hi, everyone. I think we're going to get started as people continue to come on. Good morning. My name is Shannon Moore. I am the Director of State Government Relations at Boston Children's Hospital, and I'd like to welcome you to session 2 of the Economic Justice and the Earned Income Tax Credit presentation. We have developed this event in partnership with the Office of Community Health, who led yesterday's session. At that session, you heard about the challenges of economic mobility that families of color face, and some efforts being undertaken to address them at the community level. In today's session, we will highlight the impact of the Earned Income Tax Credit and investments in family financial stability through Boston Children's Accountable Care Organization. The purpose of the Earned Income Tax Credit is to put money in the hands of families. This money does not have restrictions on how it can be spent. Families are trusted to spend the money on what they need, whether that be groceries, paying a bill, or childcare. The trust in families is important because it results in better health outcomes for children and families that utilize the Earned Income Tax Credit. While we do have the SNAP program, which assists families with accessing food, there's a general lack of resources to support families with other needs. This lack of resources is a systemic issue that Boston Children's Hospital is committed to addressing through the work of our offices, including the Office of Government Relations and Community Health. Today, we have the pleasure of hearing from two experts, Richard Sheward from Children's Health Watch and Dr. Snehal Shah from Boston Children's Hospital. You will also have the opportunity to take action today on current policy initiatives after these presentations. We will also be having a question and answer session at the end of the presentations. Please type your questions into the Q&A box at any time. If you have any technical issues, please feel free to ask about that in the chat box. We will also answer as many questions as we can. Additionally, after today's session, you will receive an evaluation sent through Zoom. Please fill this out so that we can continue to improve our sessions. You will also receive a follow-up email with recordings of both sessions and all materials. With that, I would like to turn it over to our first speaker, Rich Sheward, Director of Innovative Partnerships at Children's Health Watch.
Hi, good morning, everybody. My name is Rich Sheward, and as Shannon said, I'm the Director of Innovative Partnerships at Children's Health Watch, which is a national network of pediatricians, public health researchers, and child health policy experts headquartered at Boston Medical Center, but operating in 4 other cities in the US. You can go to the next slide. So today I'll be sharing a bit about financial mobility in the context of Massachusetts and the Earned Income Tax Credit, and a coalition that we have brought together over the past few years called the Healthy Families EITC Coalition. We can go to the next slide. So our roadmap for the next 20 minutes. First, I'm gonna sort of set the context and set the stage by describing what the EITC is and what the related health outcomes are of the EITC. And then we'll explore a little bit about why it's been such a successful program for families. And then we'll back up again and understand what is the current status of the EITC, both at the federal level and then here in Massachusetts. And then we'll dive back in to talk about the work of the Healthy Families EITC Coalition here in Massachusetts and opportunities that you can all take to get involved in policy advocacy. Next slide. So the Earned Income Tax Credit is a refundable tax credit for working people with low to moderate income that the federal government, many states, including Massachusetts, and even some local communities offer. It's really designed to incentivize work and help reduce poverty, particularly among families with children. And the EITC has been around since 1975. So there's a long history, a long bipartisan history of support for the EITC. To give you some context, we're looking here at the chart of how the EITC is structured at the federal level. But in Massachusetts, it provides support to more than 375,000 households who file income taxes across every city and town in the Commonwealth. Massachusetts does provide its own version of the EITC that helps families make ends meet by matching 30% of the federal credit. And so the average state credit in 2019 was $637, and that's paired on top of just over $2,000 that average household received from the federal EITC. And the maximum credit that any individual, a single filer, could have received in 2020 is $161 in the state credit. And for the largest families married filing jointly with 3 or more children would be just under $2,000. And that's paired with the maximum $6,660 in federal EITC. So depending on your family size and your income, the EITC could make a real big difference in your financial situation. And we'll provide a couple examples here. So that red star that you see to the left on the sort of middle blue line, that's a single parent with 2 children, and that single parent earning the minimum wage would receive $4,000 in the federal EITC and an additional $1,200 in Massachusetts EITC. And one other example, a married couple filing jointly with 2 children, and that household earning $43,000 annually, would receive just over $2,000 in federal EITC and $650 in Massachusetts EITC. There's a link at the bottom here to a really helpful calculator where you can enter in different family sizes, filing status, number of children, and you can see how much the EITC would actually be for different types of households. We can go to the next slide. So there's been a ton of research that shows how the EITC reduces poverty and increases income for working families. More recently, in the past few years, there's been research that's linked the EITC and those anti-poverty outcomes to positive health outcomes as well. And this has been particularly true for infants and mothers. The existence of a state EITC, according to researchers, is connected to a reduction in low birth weight rates of infants. And many of you know low birth weight puts babies at risk for death and poor childhood health. In fact, a 2017 study showed that 23 states with an EITC saw a connection between EITC and reduction in low birth weight rates by 4 to 11%. Expanding state EITCs as well as the federal EITC has been linked to improved self-reported health status and reduced self-reported symptoms of depression among mothers. And research also demonstrates associations between EITCs and higher rates of specific health behaviors, including better diet and increased food security. A 2016 study found that EITCs are associated with increases in private health insurance coverage among children ages 6 to 14, decreases in public coverage, and improvements in children's reported health status. There's a link at the bottom of this screen to a policy brief that Children's Health Watch released just last year for more information. We can go to the next slide. And so these health outcomes, that's precisely why the CDC calls the EITC one of the most effective public health interventions you've never heard of. It really does fly under the radar most of the time. And that's also why the CDC Foundation and others have taken note of the health impacts and included the EITC within its High 5 Health Impact in 5 Years initiative. And there's a link here to the CDC paper with more information on the health impacts of the EITC and the growing body of literature on that. We can go to the next slide. So we know that the evidence points to the EITC playing a role in better health outcomes and certainly better financial stability for families. But why exactly? And given how complex and wonky tax policy can be, the answer is quite simple. Children's Health Watch founding PI, Dr. Debbie Frank at Boston Medical Center often uses the Sutton's Law to explain this. When asked the bank robber Willie Sutton, why do you rob banks? His answer was, because that's where the money is. EITC is one of the most important and one of the largest means tested transfer programs in the United States. It's been around since 1975, and it's grown to be one of the least controversial elements of the US social safety net. And for different families to varying degrees, poverty is the common root to many of the health-related social needs that we all find in our clinics and our communities. And while income isn't the only answer, providing low-income families with cash to use as they see fit could be perhaps the secret sauce that enables these positive health outcomes. There's a great story here that's included in that CDC Foundation report in the link on the previous slide about a specific family, Jasmine and her husband, who were able to use the EITC to repair their car and then have that transportation to get between 2 part-time jobs. It allowed them to buy healthy food for their family and better manage her blood pressure. And that helped her in her first 2 pregnancies, and their son was born full term at a healthy weight. And that's just one example. And there are many stories of how the flexibility of the EITC has allowed families to really use the benefit as they see fit. And that's perhaps what is behind the correlation between EITC, especially increases in the EITC, and positive health outcomes. We can go to the next slide. So this is really meant to just give you a sense of where the earned income tax credit sits within our social safety net. So on the x-axis, we have different income deciles, the lowest income going up to higher income, and the dollar amount in federal social safety net programs that decile receives. So in the second decile, the benefits are about 50% coming from Medicaid. That's the bulk of it. But almost a quarter of the benefits received by the second decile are EITC. And then the third is followed by SNAP. So between Medicaid, EITC, and SNAP, that really does make up the bulk of the social safety net that's available for low income households. And you hear a lot about Medicaid in the news, you hear a lot about SNAP in the news. More recently, we have been hearing about EITC and the CTC, the child tax credit. But for the most part, the EITC is very much an under the radar policy because it's enmeshed within our tax policy and our tax code. And that reduces a lot of the stigma that social safety net programs tend to have. It's a huge part of our social safety net though. We can go to the next slide. So we're going to zoom back out and get a sense of what is the current status of the federal EITC. So there have been some really important changes that have been made within the American Rescue Plan that was passed by the Biden administration in Congress. What it does for EITC specifically is it increases it for childless adults, and it expands the age eligibility to 19 to 24-year-olds and workers over age 65. So historically, the EITC has been quite impactful and generous to families with children, but for single adults, some of whom are non-custodial parents, the EITC has been a very small amount. You remember perhaps from one of my earlier slides that the max EITC a single filer could receive in Massachusetts is only $161. And so expanding the EITC for childless adults was a big change, and enabling younger workers and older workers to access the EITC was also a much needed change. But most of the changes and improvements to our family sustaining, supporting tax policy in the American Rescue Plan were made to the child tax credit, which is very much a complement to the EITC. So what this did was it made the child tax credit fully available to children and families with low earnings or no earnings. Usually it rewards families at the upper end of the income scale, and some families don't necessarily earn enough to receive the full benefit of the CTC. Now they are able to receive the full child tax credit. It also increases the max child tax credit to $3,000 per child and $3,600 for children under the age of 6. So for children who are between 6 and 17, you're going to receive $3,000 per child. For children under the age of 6, it's $3,600. And the maximum CTC begins to phase out for couples making $150,000, individuals making $112,500. And what the punchline is that these changes between the EITC and the CTC are going to lift over 4 million children above the poverty line in 2021 and cut the number of children in poverty by more than 40%. These changes were part of the National Academy's recommendations on how to reduce child poverty by 50% that came out in the past couple years or so. And it's just super impactful that this was passed. And we'll hear this evening during Biden's address ideas and efforts to expand this beyond just the 1 year that this has been passed for. So we can go to the next slide. So what is the current state of the Massachusetts EITC? Some of these numbers are a little small and a little blurry, but basically the Massachusetts match to the federal EITC is at 30%. And you can see based on your income and your number of children that you have, what your federal EITC would be and what your state EITC would be. So it can range anywhere from $161 to about $2,000. And on average, households in Massachusetts receive about $600 in the state EITC. All right, we can go to the next slide. So now we're going to dive in again, and this time we're going to share a little bit of information on the Healthy Families EITC Coalition. So this is a group that was formed in 2014. We're a statewide network working to improve the health and well-being of Massachusetts children and families by strengthening the EITC here in the Commonwealth. There are over 30 members, including Boston Children's Hospital and Children's Health Watch and many others that are focused in this effort, from community-based agencies to legal advocates, professional associations, civil rights organizations, healthcare institutions, and most importantly, Massachusetts workers and their families. Together, the coalition has seen the EITC increase from 15% of the federal credit to 23%, most recently, where it stands now at 30%. The coalition has also advocated for vital funding for volunteer income tax assistance sites that provide free tax prep. We've been successful in advocating to provide funding through the state budget for those VITA sites. Normally they're funded from the IRS, and now Massachusetts is supplementing the IRS funding with $820,000 for VITA sites, which is incredibly important for access because 20% of households who are eligible for the EITC are not claiming it. We can go to the next slide. So I want to share what the coalition is up to right now. There are 2 bills that have been filed, one in the House and one in the Senate, and you can see them here, the Senate bill listed first, followed by the House bill and the sponsors of those bills. And these are identical bills, and what they're really aiming to do is to transform the earned income tax credit into a guaranteed minimum income credit so that the state can cover more households and deliver larger cash benefits. This is going to be accomplished through 5 reforms to the EITC. We can go to the next slide. So those 5 reforms, what are they? First and foremost, and this has been a priority of the coalition since 2014, is to increase that state match up to 50% of the federal credit. So by increasing that match rate, we'll put more money into families' pockets and help recipients across the income spectrum. In addition, it would establish a minimum credit of $2,400, which is really the core provision needed to transform the EITC into a guaranteed minimum income. And what this does is it affirms the idea that everyone in the Commonwealth deserves a basic level of support, no matter what their work status is. It would create an income floor while retaining some of the original phase-in and phase-out structures of the EITC, which is designed to encourage work. It would extend the credit to middle-income families who are currently ineligible. Currently, the EITC will phase out completely for families earning around $50,000. And what this bill will do is move that phase out to families earning up to $75,000 to help deliver support to families that currently live paycheck to paycheck. And also very important, it expands the EITC to previously excluded groups of people. Many are excluded altogether and would benefit from cash assistance, particularly immigrants who pay taxes with an individual tax identification number, an I-10 number, despite the fact that they pay the same share of their income taxes as those with Social Security numbers. They're ineligible to claim both the federal and state EITC. So this would allow Massachusetts to join 4 other states that in 2020 alone have expanded their state EITC to those filing with an I-10 number. It would allow unpaid caregivers who are making essential societal contributions by caring for children under the age of 6, dependents who are permanently and totally disabled, or qualifying relatives over age 69 with the ability to access that minimum credit. So that $2,400 credit would become available to caregivers with no income. It would also allow low-income college students who are not being supported by a parent or caregiver, a group that often struggles to pay for food or rent, to also access that basic credit. And it changes the age eligibility, similar to what has happened at the federal level, to younger workers under 25 and older adults over the age of 65. It improves the credit through more frequent payments. So it provides an option for 50% of the credit to be dispersed on a bi-weekly basis in advance over the course of the tax year, and the remaining 50% of the credit to be dispersed after that individual's tax return is received. So this would allow the credit to be factored into families' budgeting and afford recurring expenses. It would also provide information and assistance on outreach and communications on the availability of VITA sites to help close that 20% of households that are not claiming but eligible for the EITC. So those are the 5 reforms to the EITC that these bills envision. And we'll go to the next slide. To give you a sense of what this looks like, on the bottom you can see the current state EITC, and on the top you see the new guaranteed minimum income credit. And the red star represents, again, a single parent with 2 children earning minimum wage. They would receive $4,000 in the federal EITC and $2,400 in the Massachusetts EITC, compared to only $1,200 in Massachusetts EITC today. So a big boost to that single parent with 2 children. And then on the next slide, we see for households that are joint filing, so a married couple filing jointly with 2 children, same example as before, earning $43,000 annually, they would receive $2,100 in federal EITC, and again, the $2,400 base credit in Massachusetts EITC, compared to only $651 today. So that's an even bigger boost for that couple earning $43,000. So you can see from the previous chart and this chart just how transformative this makes the EITC and how it extends into the middle class. And it's also, again, I'll reiterate, now it would be available to I-10 holders and caregivers, college students, and younger and older workers, those who have been intentionally or not left out of the EITC. And we can go to the next slide. I know we'll have questions at the end, but here's my email address. You can contact me, and these slides will be available, and the links at the bottom of the slides will be helpful in sharing more information. So thank you very much.
Thank you, Rich. And as Rich mentioned, we will be doing a Q&A, so please feel free to type questions into the Q&A box as they come up for you. Next, we will invite our next speaker, Dr. Snehal Shah, to turn on her camera and unmute. Dr. Shah is the Associate Medical Director of Community Integration in the Department of Accountable Care and Clinical Integration, and is an attending physician in primary care at Boston Children's Hospital. Dr. Shah?
Hi. Hi there. Thank you. I'm having just 1 second of technical trouble. Give me 1 second.
Not a problem.
Okay, great. My Zoom is not cooperating. Hang on 1 sec. I don't know why it's doing
Well, we can hear you, so that's a good sign.
Right. Yes. Sorry. Okay, let's see if this will work. We did all the testing ahead of time, and now it's like, okay. All right, let's see. Okay, that should work. You can hear me and see me now?
I can hear you. I'm not sure if other people can see you.
Okay,
But,
How's that?
oh, I can see you
I
now.
restarted
Okay,
it.
great.
Okay, great. Sorry about that. Good morning, everyone, and thank you again for having me. As Shannon mentioned, I'm a primary care pediatrician here at Children's, and I also work in the Division of Accountable Care and Clinical Integration as part of the, including the Boston Children's Accountable Care Organization. In this work, I focus on strategies to address social determinants of health as a pathway to health, to promoting health equity. And today specifically, I'm going to talk about the Earned Income Tax Credit and the other credits as a practical strategy where healthcare entities, whether you're the ACO or primary care site, could think about using the Earned Income Tax Credit as a practical strategy to address social needs. Next slide, please. Great. So there's really two big questions I'm going to try and sort of lay out and answer for us, or at least give you my opinions on them. The first is sort of like, why would we as a healthcare entity, again, whether you're the ACO or whether you're a clinic or an individual provider, why would you sort of focus on or think about family economic stability? Why would you think about a family's income and their socioeconomic status in your work? And second, given that you do think about those things, what could you do to sort of promote economic stability? And I think, again, this is focused on this connection between economic stability and EITC. Next slide, please. So I'm going to start back just a little bit talking about health-related social needs. And health-related social needs are those things, as you know, are the material circumstances of life. Do you have enough food to eat? Do you have a safe place to live? Are you able to get to and from where you need to be? There's a significant amount of research that suggests that health-related social needs are associated with child health outcomes, mental health, respiratory health, child development, child academic achievement. It is strongly believed that these non-medical factors contribute to child health. And from my perspective, again, this might not be shared by all, but given that these things are connected to health, it's the primary reason that we in healthcare need to be thinking about identifying these needs and how to address them. The needs affect health, so we in healthcare need to do something about it. And increasingly in healthcare, we are, as you know, screening for these needs. Is somebody is a family food insecure? Are they housing unstable? And to a lesser extent, we are responding to these needs. And we're trying to develop systems to figure out how to integrate medical care with social care. And here in Massachusetts in particular, Mass Health, our Medicaid agency, is actually requiring accountable care organizations to screen for these social needs. Next slide. So I'm going to share with you just a little bit of preliminary data. It comes with all the caveats that, like, I did some of this analysis last night. I tried to update it, so it's preliminary, but it gives you a snapshot of sort of for our families, and this is specific to BCH Primary Care, which includes the Martha Elliott Health Center and our CHPCC, or the Primary Care Center at 300 Longwood. And it just gives us a snapshot of pre-COVID. Okay, so this is pre-COVID, where we asked families about, do they have housing needs, food needs, energy insecurity, and transportation needs. And you can see here the sort of prevalence of those needs in our population. So prior to COVID, over 20%, so over a fifth of our patients who responded to the surveys told us that they had housing needs. 15% had utility needs. Over 10% had food insecurity, and 6% had transportation insecurity, right? So families are telling us that these are things that are going on in their lives. And across the population that completed the surveys, over a third reported at least one of these needs, right? So again, it's something that we need to pay attention to. And these things may be significant barriers to our patients being healthy. Next slide. So we know these needs exist in our patients, but in healthcare, I think something I hear often is that sort of, we provide medical care. Providers and staff and clinic systems sort of think, what can I do about food insecurity? What can I do to help somebody with housing? And in many instances, these needs feel like they're but they are actually chronic and recurring. We see them over and over. So let's say if you help somebody, you support a family once who has food insecurity, you're oftentimes likely to see them back with the same need either very quickly or over the course of time. So if we agree that we need to support kids in this sort of non-medical approach, we then need a framework, right? We need a way to think about how best to support families who have these chronic needs. And this starts with the understanding that these needs are rooted in structural and social determinants that promote economic security or insecurity, right? Depending on sort of where you are on the end of the spectrum. So next slide. I'm just going to spend a minute, for folks who know me, that I'm sort of a little obsessed with this framework. I really like to think about sort of how families were sort of put into this situation where they are having a struggle meeting their daily needs. And this is a framework that is adapted from the WHO framework, but really it's around this idea that there are these structural and social determinants of health that contribute to these health-related social needs that we are then sort of seeing in the clinic. So in that first rectangle, you're seeing the sort of political, social, economic context of life, which includes racism and discrimination, past and present, that have then, in the second sort of rectangle, materialized as differences in social and economic status across populations, right? So this means that you're in an economic or social situation that then determines your access to things that can keep you healthy, which is in that blue rectangle. And these are the things that we often think about as social determinants of health or health-related social needs, your basic material needs and psychosocial factors, which are all then related to health. And all these arrows are bidirectional, right? The model is linear, but it's really circular in the way health is impacted. Next slide, please. So I'm just going to give a very concrete example related to food insecurity so you can help sort of understand how this model works, right? So we have the social and political context that leads to what are basically an under-resourced educational system. This under-resourced educational system leads to, lower educational attainment and lower income for a particular individual or a particular family, which is then directly connected to food insecurity and the inability to sort of have food to feed your family, which then for children has been in the evidence base associated with developmental, educational, and health, behavioral health outcomes. So next slide. So this broader framework, right, helps us understand then where we as healthcare could potentially intervene. And what I'm showing here is how we think about how to support families with these needs. So imagine now we have a food insecure family presenting to us in clinic. A lot of times and in a lot of systems, we do what is sort of a common and immediate response. We can refer them to some food resource. So a food pantry is where we might commonly refer a family. You're food insecure, let's connect you to a local resource in the community where you might be able to access food, which is important, really important across the board for the family so that there's food on the table, and for the healthcare system to substantially sort of feel like it's doing something to support this need. But the question is sort of, is there something else we can do, right? We can support them by helping them access food. What else can we do? So next slide. EITC provides us with an opportunity then to think even more upstream. Is there something else we can do? And my answer to that question is yes. We can address the immediate food need that's presented to us, and then we can also move upstream and address some of these economic roots of food insecurity. And one strategy, again, is connecting families and helping to ensure that they can access EICT and to bring more financial resources into the house. So the strategy is food and money. Next slide. And what I'm suggesting here is that healthcare, again, can provide supports to address an immediate need, which could be housing, it could be energy insecurity, it could be food, and couple that with a strategy to support the economic stability through filing of taxes and accessing EITC. as Rich mentioned, and was sort of mentioned yesterday through some of the presentations, EICT is a well-known anti-poverty program. It brings money into the house. And as Shannon mentioned earlier, it puts money and power into the hands of families. Too often, a lot of these sort of programs feel very paternalistic. They sort of provide you resources and then say to you, this is what you should do with it. And EITC provides the resource and is built on this trust, right? Families know what they need. They know what is best for them, for their kids, for themselves. And it allows them to sort of decide how to prioritize and what to do with this money. The other sort of appealing aspect of EITC, as you heard from Rich, is that it's a system that exists. It's not something that healthcare has to design and build on its own. What we have to figure out is how to better connect families to it. But it's an existing resource that we should optimize and maximize families' connections to it. Next slide. So now what I'm going to describe to you is some of the work that we have done. So by we, I'm talking about the work that's been done in the BCH Accountable Care Organization. And just to sort of remind folks, the organization is responsible for over 100,000 kids throughout Massachusetts. And we work with the clinical practices throughout the state, which include, again, the practices, primary care practices at Children's, but also about 70 other practices throughout the state. And Mass Health itself has actually provided the ACO and subsequently sort of clinical practices with resources to help support families who have housing instability and food insecurity. And what we have done in our program is built in a component that not only addresses, again, the direct housing and food needs, but also includes a process to support families to access EICT. And while the work of the different practices differs, we have focused in this work on sort of 4 domains, which I'm going to sort of describe to you. The first thing we've done, and this is ongoing, and actually I want to say that this has been done in partnership with so many people within the ACO, but also across the clinical site. So what I'm describing to you is work that has really been a real collaboration and includes lots of people's efforts. The first focus has been on training. We wanted to make sure that staff in the sites understand sort of what is EITC, why would we focus on economic stability, how could we sort of support families, how to have this sort of awkward conversation about money, right, which is not something we do often in our clinical settings, and really feeling like the staff are informed, and as stakeholders they're sort of brought along on this strategy about why we would do this work, connecting families to existing resources, and why these things have sort of aligned directly to affecting housing and food. The next thing we did in this work, and this is sort of all happening sort of simultaneously, is really building the community partnerships that we needed to do this work, right? A lot of this work has been going on, we're lucky, in Massachusetts in many different settings, and we were able to sort of connect with a variety of partners to help us think about how we might do it in our setting. As healthcare, we sort of have the opportunity to refer families to free tax preparation. These sites are called VITA sites, so volunteer income and tax assistance sites. We could refer families to that. We could also actually serve as a site, as a place where people could come to and actually have staff, tax preparation staff at our sites to help families fill out the sites, to fill out their tax, to file their taxes. And you could do versions in between. You could refer families, you could refer them and then check up and say, hey, were you able to do this? Do you need any help doing this? All the way to, again, being a tax site. And we've been fortunate, again, to have several partners who have helped inform and support our strategies, the Medical Tax Collaborative and the folks at Street Cred at BMC. We partnered and did a lot of learning with the Mass Essentials for Childhood, the Boston Tax Help Collaborative. Again, lots of sites, and we're fortunate to be to have these partnerships to help inform our work. And again, the way, because of COVID, this model sort of has changed right now in that we aren't doing any sort of in-house tax preparation. A lot of what we're doing is referring families to places in their community or online where they can access this virtual tax preparation site. So in that third bucket there, you can see sort of inform and refer families. That's a lot of what we've been doing. And again, many families are aware of this. Some families are accessing this. And I feel like our role in healthcare is to inform families and then connect them to ways in which they could file their taxes and access these credits. And then the last bucket of sort of the work we've been doing is really trying to learn about this. This is the first time in the BCH ACO that we are approaching this work, and there's a lot to learn and a lot to help our strategies evolve over time. And we're very actively doing that. You know, does simply referring families to a VITA site, does that actually work for us? Not sure, and we're trying it to figure out, is it working? Next slide, please. I just wanted to bring this up because I think it's important to sort of see sort of in our state what's happening. And so let me orient you. This is data that is, I think it's the 2020 data for that first little table, which basically talks about the number of people who claimed EITC. And so it's about a little over 350,000. And then the next column there is the sort of amount paid out. So $777 million paid out to families in Massachusetts with an average amount returned of $2,100, which for so many families is a significant amount of money, which is fantastic, right? It's a program that is getting money to people. The next table there is actually the participation rate in Massachusetts. And I started first with the last year where we had this information. And again, I got this directly from the IRS, where 78% of people who were eligible actually accessed it, right? So that actually means in the year of 2017, 91,000 eligible families did not get it. So that is money that sits left on the table that they could have had access to, which is almost 200 million unclaimed dollars, again, just in Massachusetts, thinking about the rest of the country. So there is an opportunity here for us in healthcare to contribute to the process of helping families access these dollars. Last slide, I think. And again, just thinking, if there's one thing to think about and one thing I could leave you with is, as you're thinking about how to support families who have these different types of needs, food, housing, transportation, think about coupling it with EITC, accessing EITC and other benefits. I think that was my last slide. And just thank you. And really to thank you for listening, but also for all the people who've been in partnership with us as we've been doing this work over the last year and a half.
Thank you, Dr. Shaw. That was a great presentation. Before we head into the Q&A, we're just going to take a minute to let you know how you can take action to support the passage of EITC legislation. Before we get into the action step, as Rich had mentioned, there is a piece of legislation currently being considered at the state level. Children's has put together a fact sheet for this legislation. If this legislation were to pass, every family earning up to $75,000 would be guaranteed to receive a minimum of $2,400 per year. Page 2 of our fact sheet tells you why this legislation is important for children and their development. The EITC helped lift 3 million children out of poverty in 2017 and has kept more children living above the poverty line than any other tax credit program. So this is how you can take action. A key part of the legislative process is gathering co-sponsors for a bill. We have formatted an email for you to send to your elected officials requesting that they co-sponsor the EITC legislation supported by Boston Children's. You do not have to find your legislator yourself if you don't know who it is. Our system will connect you to your legislator, and once you have tailored your email, you can send it off with a click. We will now invite our panelists to the Q&A. I think we will start with a question that came in live during the chat. I think this might be for Rich, but Dr. Shaw, please feel free to jump in as well. We had a question asking how the EITC is publicized. It sounds like there may be a communication problem with getting this information out. And kind of a secondary question on this, there was a question about how the program is publicized to people when the English is not their first language.
Yeah, I'm happy to take a stab at that. So, oftentimes it can be tricky for families to know, did they receive the EITC? They'll often remember and know that they filed their taxes and that they received a refund, but not necessarily that this was the EITC and that was the CTC and the details of it. Some families are really savvy and know that, others, and I would argue maybe most don't. And more often VitaSites do a wonderful job. The City of Boston does a wonderful job. Action agencies do a wonderful job of advertising and communicating to, file your taxes, claim the EITC. Code for America has a wonderful advocacy sort of outreach campaign on getting your refund and getting the money you've earned, but more could be done for sure. And then in terms of the language barriers, definitely there are language barriers. VitaSites often do have, especially those that are located in different communities that have a high percentage of people who speak Portuguese or Spanish or Mandarin, and they have volunteers that can speak those languages and provide translation services. But in times of COVID, that can be a challenge, especially on the technology side of things, is in-person tax prep is very limited as well.
Great, thank you. We had another question submitted to the Q&A. It's asking if a family did not use their tax credit in past years, are they able to refile?
I think they can. I see Stanhouse shaking her head, yes.
Yes, I think at least for a year or two back, I was having a conversation with some of the VitaSites about this. And so, yes, so if they haven't, they still should and they can. I'm not sure what changes with the, I don't think that has changed.
Great, thank you. Dr. Shaw or Rich, as a provider, outside of referrals to tax preparation support or food pantry, how else can folks working at the hospital help families experiencing financial instability? So
I can take a stab at this, and certainly very happy to hear your thoughts. So one of the things we've been thinking about is this sort of more upstream approach to things, right? And I think that EITC is sort of one example of basically an underutilized resource. And I think one layer of work that healthcare can do is that there are several existing benefits that families who are eligible are not actually accessing, and try to sort of close that gap, right? So you may have seen data out there that there are some families not accessing, who are eligible but not necessarily accessing SNAP. So what we have done as part of this ACO project is actually over the course of the next year, we're training all of the staff who are directly working with patients in these understanding in some detail what these benefits are and who are eligible and who's eligible. And then when they connect with families, they go through and we have a list of things like, are you getting this? Are you accessing sort of the DTA school clothing benefit where you get $350 every September to buy school clothes, right? So there's a whole list of things that exist that are underutilized. And so we're trying to close some of that gap in what I think of this sort of maximizing the resources that are coming into the household and make sure people are connected to all of those things. I think the other spaces, depending on whether you're talking about food or housing or energy insecurity, there are things that you can do in healthcare that involve, sort of connecting families to appropriate resources in the community, but then also sort of like, I think a referral is great, but for many families, we need to go beyond the step of just, hey, referring you to this partner in the community around housing, we kind of have to stay involved and do what I think of as a little bit of a co-management model with our friends in housing. We're managing certain things, we're supporting families to manage certain things, and then the housing agency will help to manage certain things. And then the last thing I will say is that from healthcare, this kind of advocacy that Shannon and her team are doing around expanding this, that Rich's team that are doing around expanding this benefit is so important. And so in ways that we can do that either through testimony or data or other forms of advocacy, I think healthcare and healthcare providers and clinical settings have a real role in that.
Thank you, Dr. Shaw. So we've talked a lot today about advocacy, and we are sending out an action alert. But Rich, are there other ways that folks could be involved in the EITC coalition as an individual?
Absolutely. We have, no barrier to getting involved in the EITC coalition. We have monthly, virtual meetings where we discuss the latest, action on the bills that we're advocating for. And I think one of the best ways to really get involved, especially as the budget process in the state moves forward and the legislative process moves forward, when a hearing is scheduled, submitting testimony on these bills. Why, from your perspective as a healthcare provider or a healthcare team member, is this vital and important to the well-being of the patients, the members of your community? Testifying will be huge. And contacting your legislator, especially at any time. You don't have to wait until a hearing is on the books. Reaching out to your legislator to have that conversation, and we're happy to provide fact sheets, and the Boston Children's Hospital fact sheets are amazing. So I think those are really good ways that anytime you can, get involved.
Thanks, Rich. And just to echo that, as folks are thinking about contacting their legislators, if you ever have any questions, you can always reach out to the Office of Government Relations about how to contact your legislator or what to say if you don't know. We're here to help. So please feel free to contact me or anyone on our government relations team. Let's see.
Shannon, there was a comment by Dr. Homer in the questions around also discussing the anchor institution role of BCH and BMC as an upstream strategy, and I completely agree. And Tara Agarwal spoke about that yesterday in some detail, and I think it's also a very important approach to sort of the role of the hospital in the community as an upstream strategy.
Great. I think we have time for one or two more questions. I think we have a question in the chat here. It says, what strategies is the hospital using to get this information into the hands of patients, and what types of staff are having conversations with patients?
So the strategies are I think there's sort of a couple of ways. I know that certain institutions, like BMC, for instance, right, they've been doing things like sending out text messages to all of their families about, EITC exists, click on this, I think it's through Street Cred link, in order to sort of consider, to have an opportunity to sort of file your taxes electronically. So there's that kind of campaign. Right now at Children's, much of what we're doing is when we're having, we aspire to something where we can send sort of broader messages, but right now a lot of it is related to individual contact with patients and families around, hey, have you done this, and would you like more information about it? This question about what layer of staff or which staff are actually communicating this and working with families on this, I think it from my experience, it varies depending on what setting. So for instance, there are social workers who would communicate this information to families. There are providers like myself, like I say this to parents that I work with, the patient navigators, resource specialists, admins, nurses, the clinical assistants, right? Like I think people in different settings will take this message and present it to families because it is so important to get out. And I think that the actual work, like the actual act of like referring somebody to, let's say, a VITA site, is happening in many of these settings through the either social work or a medical home health coordinator, which is sort of like a community health worker a type role. There's patient navigators and resource specialists, but I think it really depends on sort of like what works for your setting and who has that type of relationship and contact with the families to basically talk about something like income or economics with families.
Great, thank you. I see questions are still coming in. Unfortunately, we are running short on time, but we will be able to respond to these questions via email after the presentation. We will send out all of the information, the presentations from today, and respond to the questions that we didn't get to. We want to close by thanking our panelists again for their time. Thank you so much, Rich and Dr. Shah, for joining us today. And thank you everyone who came to this webinar and yesterday's webinar on this important topic of economic justice and the earned income tax credit. We welcome you to, again, send us questions. Alexia put our government relations email in the chat, and we will send out the recording and the materials. So thanks everyone, and I hope you have a great day.